Hi, I'm Dan Cohen, Captain with Williamson County EMS, and we're here on Rescue You with Dr. Tanya Glenn. And today we're going to ask her about sleep, something that none of us get enough of, and certainly those of us who work shifts. How much do you think the poor amount of sleep and bad sleep cycles affect our life and health? Is there a way to manage this better? I feel it is a problem that has attention but not being addressed well enough.
Absolutely. Sleep is so vital. When I teach the resilience class now, what I'm mentioning is that the suicide epidemic, the number one problem is lack of sleep. So when you don't sleep enough and when you don't sleep well, your mental health suffers, right? We're looking at depression, we're looking at increased anxiety, we're looking at suicidal ideation. If we push you hard enough, you'll have a psychotic break. And so the sleep is a huge issue. What we're always recommending is that if you're at a busy station, if you're in a busy sector, if you're on patrol and you're going and going and going, what we want people to do is to make sure that on their days off, they are getting enough sleep. And this is massively important. The population I worry about the most are paramedics and firefighters who work 24-hour shifts in busy stations, who have toddlers at home and who have second jobs. When do you possibly sleep? And you guys, sleep is so important for your mental and physical health. Think of sleep, okay, when you tell your computer, when you are sleeping, when you're away from your computer, and you tell it to run the virus scan, and you tell it to download the updates, and you tell it to do all the stuff that really slows it down, that's what sleep is for your brain. And so not getting enough sleep really impacts your overall health so significantly. I agree. EMS has been we're just going to tough it out. We're going to suck it up. We're just going to do it. We're going to live these dysfunctional lives and rock and roll. And I think we're aging enough to where we're realizing that's a really bad idea. And so giving people respite and time to really unplug and get good quality sleep is super important.
And do you have any hints for people that do have the EMS work and the second job and the toddler at home? I was lucky I had all of those things except the toddler at home. So when I got home, I could make it quiet and go to sleep. What are some things that those folks can do?
So I think the biggest thing is to have a plan and have a schedule. So maybe your kids are in daycare or there's the other parents watching them. Your first day off, you need to take a nap. If you work in EMS or fire, you need to take a nap on your first day off. Declutter your room, stay on the same schedule, go to bed and get up at the same time every day. Really don't fight in your bedroom. Don't bring that negative energy in. Turn off your social media about half an hour before it's time to go to bed. Make sleep something where you are so consistent that you train your brain and your body. Okay, it's this time of the evening, it's time to go to bed, and it's this time of the morning, it's time to get up. Don't ruin that pattern that your body's trying to habituate to, and really just keep it as consistent as you can.
So I heard two magic words in there. One was training, and that's something that EMS and firefighters never do. So we should have no problem with that because we can train to do it.
Train
right?
your brain.
So that sounds pretty good. And the other one was consistency. And training, of course, can lead to consistency. So I like the sound of that. Maybe I could have benefited from hearing that about 10, 15 years ago. Dr. Tanya Glenn, thank you, and thank everybody for watching Rescue You.
If you have any questions you want to ask us on Rescue You, go ahead and scan this QR code and send them to us. Please understand, in no way is this a counseling session or any sort of clinical advice. If any of the content has triggered you, or if you feel like you need help immediately, please reach out to your local mental health professionals or to any peer support teams that you have in your area. If you're in a crisis, here are some national resources for you to contact immediately.